Well, joining me now is Professor Daniel Sessler, Director at the Outcomes Research Consortium. Professor Sessler, thank you so much for joining us.
It's a pleasure.
I wonder if you could start by telling us about the Outcomes Research Consortium. What is it and what services does it provide?
The consortium is the largest clinical anesthesia research group in the world. We have about 190 members in perhaps 20 countries. We run hundreds of simultaneous studies. It's also the most productive clinical anesthesia research group. We publish a full paper every 2.5 days. Since founding, the consortium has published 1,600 full papers. To put this in perspective for you, that's equivalent to every paper in every issue of a journal like Anesthesiology for 12 years running.
So huge amounts of work that you've been carrying out then. How does the consortium fit into ASEIC? What common goals do you have?
I think we all have the goal of improving perioperative care. That's certainly our goal. Perioperative patients do very well during surgery. Intraoperative mortality is so rare that it's hard to measure. Postoperative mortality is not. About 2% of inpatients over the age of 45 die within a month of surgery. To put this in perspective for you, if that were considered a disease, it would be the third leading cause of death in the United States.
So what would you say are some of the ways that the consortium is improving healthcare practices and interventions around the world then?
The major cause of death after surgery is myocardial injury and major cardiac events. So we're very interested in risk factors. Unfortunately, most of those are not modifiable. They're things like diabetes, hypertension, obesity, that we can't change. But some of the things we can change, and that includes blood pressure management. So we've, in the last decade, spent a lot of effort on blood pressure.
Perhaps you could give us an example of a recent study that the consortium has carried out that you're particularly proud of.
Well, we just published a major trial in Lancet in which we randomized more than 5,000 patients to be either 35.5 degrees or 37 degrees at the end of surgery. Interestingly, there were no differences in cardiovascular outcomes, surgical site infections, or blood transfusions. These data indicate that temperatures as low as 35.5 degrees are safe in perioperative patients.
What to finish on, maybe you could tell us what's your vision for the future of the Outcomes Research Consortium?
Well, we are continuing to grow and we're doing more and more large trials. Large trials really matter. It's large trials that provide robust evidence that end up guiding clinical care and making sure that we do the right things for our patients. Our goal is to do lots of those trials.
Well, Professor Sessler, thank you so much for joining us. That's all we've got time for. But thank you for joining us and telling us so much more about the consortium, and I wish you a great meeting.
Thank you so much.